Hi, I'm Dr. Matt Wiederholz here at Performance Pain and Sports Medicine in Houston, Texas, and I'm here with our patient Barbara Raney. Today we're going to be talking about lumbar spinal stenosis and the Vertiflex Superion procedure. Ms. Raney suffers from lumbar spinal stenosis, and the symptoms that she was experiencing typically are low back pain and cramping in the legs. Ms. Raney, tell the audience a little bit about the various symptoms you were having and some of the activities that you were not able to do as a result of your stenosis.
I wasn't able to do anything. I could wash a couple of dishes. I would have to go sit down because my back hurt. I could go put a half a load of clothes on and I'd have to go sit down. And it was like that with everything.
When you sat down, it provided you relief of your symptoms?
Yes. I could sit down 3 or 4 minutes, maybe 5 minutes. I could get up and do a little something else, and then I would have to sit back down.
That's very common in patients with lumbar spinal stenosis, that when we sit down, it opens up the spinal canal ever so slightly to provide relief of the compression or pressure on the nerves. And after a few minutes, that pressure is relieved and the cramping in the legs goes away and we can get up and walk around a little bit more. Some people are really severely limited and can't walk even a block. And I think Ms. Raney was quite limited as well.
Yes.
So what we've done, she's been on medications, we've done injections, all the routine sorts of treatments that patients who have this problem typically undergo. Then historically, the treatment after that is something called a laminectomy or decompression, where a surgeon goes in and removes a portion of the bone to open up the spinal canal. It's very successful. It's the gold standard treatment for lumbar spinal stenosis, but it's quite invasive. Ms. Raney wanted to avoid such an invasive procedure, and so we talked a little bit about the Vertiflex Superion procedure, which is an implant of a small titanium spacer. And that's put in through a little tube, tiny incision about the size of a penny, and a tube goes in between the bones, and this little device, which may not show up nicely on the screen because it really is so small, but this device goes in undeployed, and then there's a little tool that we use to deploy these little arms, and they hug the bone on both the upper part and the lower part. And that's put in so that the spine can't compress down this way. So when you stand up, that section is as if you're still sitting down. So you can get up and move around, and the area that was involved with the spinal stenosis is as if you're still sitting. So you can now do activities in a standing position, and that one area is still flexed. So tell us a little bit now, you're 2 months out from the procedure. Tell us what you've been able to do recently.
Well, I took a trip to the museum with oh my God, I went to the museum and I was able to go through all floors of the museum. I only had to sit down twice. And it was amazing to be able to just walk without leaning against something or hunching over, and it was amazing. And that's when I really seen that it is working. And
now, so, you were very reluctant, very skeptical about doing any procedure that involved, and you've had several surgeries in the past, and you didn't want to have another surgery, you didn't really want to have anything implanted. So this is coming from someone who is very skeptical, very nervous or reluctant to move forward with this. Would you say that you're happy with the results? Would you recommend this to other folks who suffer from this problem?
Oh, absolutely, I would recommend it. You won't believe. At first, the first month was a little rocky, but I mean, have it done. Don't have second thoughts, just do it.
That's
I
great.
wish I'd have done it way before now. When you first started talking about it,
sure.
Should have had it done then.
I'm glad that you've had such a great result.
Yes, I have.
So again, Dr. Matt Wiederholz here at Performance Pain and Sports Medicine with our patient Barbara Raney. who has undergone the Vertiflex Superion procedure, which is an interspinous spacer for lumbar spinal stenosis and neurogenic claudication, and we've had a wonderful result.
Yes, we have.
That's great. Thanks for joining us.